If anyone knows how broken our healthcare system is, it's me. I've been a doctor for over a decade, and I have seen every angle of how broken our healthcare system is. As a primary care physician, I am faced daily with having to explain the medications that I am prescribing for my patient. And I met with this medication isn't covered. Is there another medication? Or I actually have to justify the patient's diagnosis. When I think about the fact that I have this patient who is in front of me who has trusted me, I've put forward a diagnosis, and then I choose the right medication based on the years of experience that I have going through medical school and residency to be told this medication isn't covered. This medication can't be prescribed at all. Or is there another medication that you can prescribe? Often it is a medication that isn't a drug that I think is best for the patient. And why do I think it's not best for the patient? It's because I saw the patient. I know that they need to be seen by a specialist. I put a diagnosis of differential of things that this could be related to. I write why this patient needs to be seen to find out the true diagnosis. I'll get a response, this patient doesn't meet the needs. Tell me why they don't. What I hear is, your note doesn't support it, or there must be something else that the patient can have. No. The patient needs to see a specialist. And then meanwhile, my patient is wondering, why haven't they been able to be seen? Why haven't we been able to find out the diagnosis? And it's because I have a roadblock. Recently, I had a patient who came in with red eyes, goop in her eyes. I knew she had pink eye. I decided to prescribe a medication, which is the drug of choice. And I was told a couple of hours later that this medication isn't covered. What they will cover is an ointment that is sticky and goopy and difficult to get into your eye versus a drop. What does that mean for that patient? That means they are having a harder time putting in the medicine that they need. They also may not get back to work sooner because, number one, they couldn't get the medication that they tried to get right when I prescribed it. Then we had to go back and forth to find out what medication the insurance said yes to. Then my patient has to go back, pick up the medication, and then start the treatment. Sometimes the medications that insurance approves isn't the best medicine based on what I'm seeing. So what happens is that patient doesn't always get better right away versus possibly getting better sooner with the medication I'm choosing based on what I see in front of me. That delay prevents the patient from getting the best care that they deserve. Ultimately, what happens is this patient is getting sicker, or this patient is getting a delay in their diagnosis. And that can mean the difference between somebody living or dying. And it's frustrating because I went to medical school to take care of patients. And what I face instead is fighting with the system to take care of my patient. And this system hasn't seen my patient. Insurance companies often have non-clinical people working for them. They have the power to make a decision on the patient I'm seeing. And what will happen is I'll get a denial from somebody who is non-clinical and will just deny it for no reason at all and just say, nope, not approved. Then I have to go back, review my note, and justify why I'm ordering a specific test, like a chest x-ray, a CT, or blood work, or medications, or a referral to see a specialist. I have to go back and write a report or make a phone call, or both, which often happens, to justify why I, the physician, is trying to actually have a test to help my patient get the care they deserve. They'll often not approve it again. Then what happens is a peer-to-peer review. Somebody will come on the phone. Sometimes they're clinical, sometimes they're not. Dr. Curry Winchell or Dr. Bayo, why did you decide to order this blood test? And I'll paint a picture for them. It's insane to have to share why that test is the best test for my patient. To have to explain to somebody why I'm ordering that is infuriating. This system is backwards and makes no sense. I want to do my job. I want to see patients. I want to order the tests that they deserve. I want to be able to get my patient to a specialist. And you know what else? I want to order all the tests that they need. I have to justify every step I make in medicine to a company that is not a part of my patient's care. For those of you who are listening out there, the things that you can do when you face this, number one, you do not give up. They are hoping that you won't call and that you will take the denial and pay or find some sort of alternative treatment, medication, image, or just not take that medication or not go to that specialist. That is what they're hoping for. So when you get a denial, you call. And you write down who you are speaking to. Ask, can I speak to somebody who's clinical, who can review my case? Because I'd like to know why you have decided to deny my medication or test, because my doctor has shared that this is important. So I'd love for you to document that. Ask them to put it in writing, specifically why they think that medication, lab test, order, or specialist is not needed. And if you still get denied, you can report them with licensing boards, different agencies, anybody, and share, this is what my insurance is not allowing me to have done. After you do that, share that with the insurance company. Tell them, I decided to go ahead and report this denial because you haven't been able to tell me why you are denying a plan of care that my doctor knows is necessary for my care. We as doctors are on our patient's side. We went to medical school to help, not to go through a system that requires you to justify every single step you do when you are trying to help your patient. It is a system where I have to learn the ins and outs of how to navigate and fight the healthcare system. When you deny, you delay. You delay the time my patient is able to get the care that they deserve. We have to do better. And how do we do better? We unravel the current system that we have right now and make it about patients and make it individualized so that patient who is facing whatever health journey that they may be facing gets the care in a timely manner and in a manner that serves them.